Started. Today's webinar topic is SHIP grant guidance and management. We understand that's a little vague and also wide-reaching, but we hope to narrow that down as we get started. And so we are going to talk a little bit about some various aspects of the SHIP grant. Fiscal year just started yesterday. And so we felt like this was a great time to catch you up on any changes, things that are going on, so you can prepare your reports and your next year appropriately. So as we go through, feel free to ask questions, chime in. If you want to yell at me, that's cool too. Feel free to do that. And and so let's get started with going through a few housekeeping things. As you know, the center's purpose primarily is around transition of value, collaboration and partnership, performance improvement, health information technology, and workforce. We are very committed to diversity, equity, inclusion, and anti-racism, and we encourage all of our partners and participants in our webinars and in our programs to recognize our stance on this and also to adopt their own DEI and anti-racism stance as well. You can read more about that at ruralcenter.org/DEI and let us know if you have any feedback or any questions about that. So you feel free to mute your microphone unless you want the world to hear you, which either or, that's fine. You don't have to be on camera either unless you're asking a question. We love seeing your faces, but don't feel obligated. And closed captioning is also available. At the bottom of your screen, you'll see a little box that says CC. You can click on that and it says show subtitles and or captioning. And I find that is very helpful. I have a bilateral hearing loss, so even though I can hear well, sometimes having the subtitles on is very helpful to catch a few things. Use the chat box, raise your hand feature, or come off mute to ask questions. Again, feel free to chime in. We have a bunch of people monitoring the chat box, so let us know what we can do to help or elaborate on anything. As you know, the recording is happening. Caroline has already pressed record, and this event will be made available in the next coming days for review. At this time, we're going to ask you to do two things. Number one, put your name and your state in the chat box so we can make sure we know who's here and who to follow up with if there are any follow-up questions or TA responses needed. Especially on this one, we're going to follow up with some emails and some stuff as well. And Caroline's also going to launch our pre-polling questions. These are pretty generic for the content, but we just kind of want to get your feel. As you all know, polling is important. Assessments are important. You guys all do them all the time. So it's very helpful for us if you can answer those questions for us as we get started. So I'll give you a second to get that going. Our objectives today for the SHIP Grant Guidance and Management webinar are to discover the SHIP FY2022 hospital funding and upcoming SHIP reporting dates, to understand and utilize the SHIP Allowable investment tool, to locate SHIP reporting documents and grant guidance documents on the SHIP TA website. Again, that seems pretty simple, but there are several changes that we want to talk to you about, and we definitely want your feedback. So we're excited about some of the changes. We hope you're excited about them too. So objectives are wide-reaching but measurable, and and so I think at this point, I will hand it over to Krista, and they will introduce themselves and then kind of go through these following slides. Krista.
Thanks, Matt. Hey, everybody. I am Krista Mastel, they, them, and I am the program coordinator for SHIP. I have already met many of you through phone calls, intro calls, office hours, but it is great to see so many new names, and I'm excited to get to know all of you over the next few years of this grant. So we wanted to start off by giving an overview, closing out SHIP Fiscal 21, which is the grant that just ended on Tuesday, the grant year that ended Tuesday. So up next, you'll have for us the annual report. The spreadsheet template for that was sent out via email on the 19th of May. It is also posted on the SHIP TA website. So if you are unable to access it, have questions, comments, concerns about it, please do email your project officer or SHIP TA. After that is your federal financial report and your carryover prior approval request if applicable. So note that for especially the FFR and the carryover, Those due dates are just that. The submission window is open. If you and your financial folks have everything reconciled and squared away, you can submit all of that today. And the sooner we can process those, the sooner we can move into those decisions about your carryover, about a UOB, whatever that would be. So make sure you take a look at those and get working on those submissions to close out fiscal 21. I will also note each state, each award is unique. So there may be other requirements such as quarterly reporting, drawdown restrictions, conditions of award, requests for information, things like that that may have come to you. So what you're seeing on the slide is what's due for everybody. There may be things unique to your award. So please do reach out to your project officer if you have any questions about that. So of course, yesterday we started fiscal 22. The amount per hospital on your notice of award, you should have seen that it increased by about 1.36% to $13,011 per hospital. Because that is such a small percentage, we are not requiring an updated spreadsheet or budget from you all. So just know as you're going through, so your internal processes and whatnot, that amount has changed, and make sure that you're accounting for that internally. So for fiscal 22, nothing really to worry about now, unless again, you had unique requirements on your award, such as the condition of award, quarterly reporting, drawdown restriction, request for information. But for everybody, you'll have nothing due coming up for fiscal 22 until the end of the year, that annual report. So again, just review your notice of awards carefully. Those went out about 2-3 weeks ago, and that will have any information about any additional reporting requirements that your award may have. Reach out to your project officer if you have questions. So with that, I think I turn it over to Caroline.
Thanks, Krista. Yeah, so I'm just going to briefly review some of our assessment findings from the fiscal year 21 SHIP customer service TA assessment that we sent out earlier in the year. We appreciate everyone, we sent it out in April. We appreciate everyone who took the time to respond. Your responses inform types of TA we provide, as well as just how we work with you all. And we definitely appreciate every time that you guys respond to any sort of assessment or survey that we administer, pre-polling questions in the webinars, or more formal things like this TA assessment. This year we got 31 responses, which represents about 70% of state SHIP programs. So good results there. It's a little bit more than we had last year too. Okay, so a couple things I'm going to call attention to. The first thing was this question: how long have you worked with the SHIP program? This orange portion and the blue portion represents SHIP coordinators or other personnel that have worked for 3 years or less. It's about 60% of you all, so that's a pretty high portion. This is just to call out the fact that we appreciate all the new SHIP staff and how hard you're working and learning to manage the SHIP grant and things like that. I know sometimes it can be challenging starting in a new role, but we definitely want to provide that support, especially to the new staff, and highlight the fact that you guys are not alone. Reach out to us or anyone at FORHP, or even your fellowship coordinators if you'd like assistance. The next thing, this was: what center SHIP TA resources are you most likely to use in the coming year? The top responses on this were the SHIP page, the Allowable Investments tool, the grant guidance page, and webinars. So you guys love the Allowable Investments tool and our pages. This also highlights the fact that when you all comment on improvements to these things, we do take them to heart and we appreciate what you comment on. The other thing I'd like to call attention to is that we added this response here on the far right, this open office hours. This was a new option that we added this year after Krista had suggested posting them. And we did see a lot of response from that. So that's something that we're taking into consideration to continue to host them. Okay, this next question: my organization will be able to apply the knowledge gained from the center SHIP technical assistance received. We appreciate your guys' response on this. The weighted score was a 4.32. It's really encouraging that you all are responding to these things and I guess, to say our work seems to be doing something. So we definitely appreciate that, and your participation in these webinars and any other event we host. Okay, the next question. Overall, how would you rank your state's SHIP program? So the majority response here was that good, that middle orange bar, good, and about 17 people selected good. 8 people selected excellent and 6 people selected average. No one identified their SHIP program as fair or poor, which is really positive. It's encouraging that you all have a positive outlook on your SHIP program, but we also appreciate that there is room for improvement. And then the last question I'd like to highlight, what do you feel is working well with your state SHIP program? Check all but apply. So the top category that was selected here, it's the second from left, about 77%. Individual contracts for utilizing SHIP funds. And then the second one to that was at about 40%. It was improved quality and improvement. And then the responses are fairly evenly spread amongst the remaining categories, which is, I think this is interesting to see. We're also glad that you guys seem to be utilizing your SHIP funds and feel confident in that. Things like this help us inform future webinars or any sort of TA things that we plan. So that's important to notice. I will call out the other responses. I'll just read them because I thought that they were interesting. Our processes have been streamlined with online application, online payment, and easy reporting. Someone else said, we have an excellent contractor that works closely with our critical access hospitals and meets with hospital staff frequently in person and virtually. This creates strong relationships. And then the last comment was complementing selected rural hospital flex program improvement efforts, supporting health equity and inclusion. So that's all that I have. Again, thank you everyone who took that. We definitely appreciate it. And we do pay close attention to our assessment results of all the things that we administer. So thank you again.
Yeah, thank you, Caroline and Krista, for your breakdowns. Yes, assessment findings are very important, as we mentioned at the top of the webinar about taking pollings and getting feedback. We, as Caroline mentioned, it is not just appreciated, it's absolutely necessary that we are in partnership with you, that we listen to you, that we hear you, and then also the application, because nothing's kind of more annoying than saying something and then it being ignored or, heard, but not added on. And, we can't move the moon or stop the world from spinning, but we're going to try our best to make sure that we meet the needs where you're at and help you however we can. And so, continue to do that. As you know, we also work closely, or Caroline and I and Sally, we all work with task as well. So we appreciate that a lot of you are both your SHIP coordinator and your task coordinator, or I'm sorry, your flex coordinator, and that there are some nuances and some differences between the programs, and that's hard to manage, but we definitely appreciate you. And hopefully we're making it as easy as possible and being available to you, as I said just a few seconds ago. And now we're going to get into some of the specific changes that have been made. Specifically to the website, it looks the same. I put links in the chat box if you want to go back and click on those. One thing to note is that the center as an organization is going through a major website refresh, rebrand, overhaul to upgrade the entire website. And so it'll have some same look and feel and things like that, but it will be completely updated, hopefully by the end of the year, beginning of the first of the year. We're in the beginning stages of it. So keep that in mind as we kind of go through this. The reporting template is now live. If you need any help with that, let us know. As Kristen mentioned, if you need added lines, I know sometimes people have problems adding lines to those things. Just shoot us an email at ship-ta@ruralcenter.org. We'll be happy to help you out. If you see any discrepancies or something, if you've saved your template and suddenly it doesn't start adding up the numbers like it should, let us know. We have easy fixes for that. We've dealt with that before and it's not uncommon. So don't feel like you've done something wrong and don't feel like you can't reach out to help. Don't hurt yourself trying to fix something that we can just send you a new one for. The frequently asked questions have all been updated to reflect current situations and current scenarios. Worked hard on that. And so that is also available. The link has also been put in the chat box earlier. The content on all the pages was refreshed and updated to make sure the current dates, the language, stuff like that reflected what we're doing now. We're also taking the opportunity continuously to go through some of our resources and make sure that those are up to date and not too far out of date. Like some of the webinars from like the last year are still relevant, may have some slight outdated information, but a webinar from 5 years ago is probably completely outdated for SHIP. And so we're looking at how we can archive those, but keep them accessible for reference, but also not allow them to populate when you search for something, because it's not going to help you. So we're looking at all that. And then, of course, the allowable search tool update. We do this twice a year. May, June update. This update that we're going to talk about today is always the biggest update, in which we basically throw everything to the wall and see what sticks. And that has been a process. I laughed because I was up till 2 o'clock in the morning the other day. We've been working on it for months and taking all the emails and the comments and the questions that you guys have asked and really taking it to heart, and then whiteboarding it and brainstorming and workshopping the different definitions and the things. And hopefully you respond well to the changes we've made and the changes we're going to make coming up. So let's talk about that a little bit. So the search tool, we absolutely want, need, and appreciate your feedback. As I said, the search tool was originally created to help you, right? So you didn't have to email us every time. So you didn't have to do that. And it was a way for you to go in and say, hey, can I buy computers for this? Can I buy a pencil? What can I do? Can I use money for this type of training? And it served its purpose, but then we realized real quickly that the nuance of all those things clouded the ease and accessibility of it. So we definitely appreciate that feedback. Months of planning and it's still not perfect. It won't ever be perfect. There'll always be something to add, which is why your feedback's important. So please, you're not going to hurt our feelings if you're like, this is horrible, this doesn't help at all, please change it. And we will. It's constantly evolving. We're constantly taking new things, new topics into consideration. You guys shoot us emails all the time and we're like, man, we hadn't thought about that. Or if you do shoot us an email about something that's already like unallowable or allowable, we still reconsider it. We still talk about it as a team. We email each other. We say, hey, so-and-so from this state has asked about this unallowable expense. What do y'all think? And we talk about that. Unless it's pretty cut and dry, we're going to have a conversation and do some research for you. And a lot of you guys have received that email from me like, hey, I'm researching this, I'm talking to people. We're continuing to do that. But as we do that, the search tool also evolves. And so the major considerations were to clean it up. And so what populates is relevant to what you're looking for. Distinction, what populates is identifiable. In other words, you can actually understand what it says. Interpretation, again, what populates is understood. Description, what populates considers the nuances of what you're searching. And then to condense, what populates isn't overwhelming. And so to do this, we focused on metadata search function. We added over 2,400 metadata search or terms. So what that means is you can basically search for all different pluralities, declensions of a lot of words. So if you're looking for quality improvement, you can type in quality improvement, quality, the word improvement, QI, QIS, QILs. I mean, like we really nuanced it. So it would make sure that no matter what you call it in your state, it would populate. Now, this isn't going to be all inclusive. More will still be needed, but they're easy to add. And so if you see something or you're like, hey, I looked for this and it seemed real simple and it didn't populate, shoot me an email, let me know, and I can add that real quickly to make sure that's easy to search. We focused on defining terminology. We'll get that into a second. And we merged content and redundancies. Like computers and laptops are the same thing. They shouldn't be separate results that you have to look at. So we kind of condense some of these things down into one. So if you search for a laptop or a computer, you're going to get the same result, which is hardware. And then we expanded the explanation to include some of the nuances. So what you'll see in the search tool starting yesterday, actually, is that each item will say something like, this includes these items, or this does not, like unallowable expenses include but are not limited to this, this, and this. It's that really should be helping you out with, well, does it include this? I don't know. It just says it's unallowable, but does that mean this? And so we're trying to catch these nuances. So some of the boxes got bigger, but we want, so take the time to kind of read those descriptions, but it beats having to search 400 times or just to give up and hope for the best. So we really wanted to make it easier on you and to give you those nuances. So, and of course, we included examples. In some cases where the nuance was, we're like, hey, for example, this might be a case, which is also can be found in the frequently asked questions, but you may not be going back and forth. So we wanted to make sure we included some of those in the search tool. So this is an example of one, and this actually just came up the other day, so I put it up here. HCAP surveys, and you can kind of see it says updated. That was a request that we add when it's been updated or if it's changed recently. So we added the date, and then this was one where it's hard. If you just look up surveys, it can be ambiguous, right? Well, HCAP surveys, it didn't just say like HCAP surveys are the only ones currently allowed, surveys currently allowed in SHIP. Now that's constantly evolving, constantly being evaluated, but at this moment, that's the case. So it needed to say that that's the case, rather than just saying, oh, HCAPs is allowable and then having no nuance to it. Well, what about these ED caps? What about these other things? Are they allowable? So we really wanted to put that in there. And so that's an example of what it kind of looks like. It, we'll say, at the bottom, it says see also surveys and assessments. So if you need other nuances or other things like that. And so again, you can look up HCAP surveys under survey, surveying, surveys, HCAP, HCAPs, HCAPing. Actually, even the misspelling, if you put the HCHAPS, that's in there, it'll populate. I tried really hard to catch all the nuances there. And this was an important thing too. We added some icons, okay? This one, and this one. And let me tell you, this was a lot of round robin on these icons here. The thing about it is what was happening is y'all were searching for things that may have been allowable under COVID-19, but not allowable under regular SHIP, but the iconography was exactly the same. So when you glanced at it, it was green, right? And that caused a lot of confusion. Now, wait a second, is this ARP? Is this regular SHIP? It says that it's allowable. And it may have said COVID-19 in the description, but the first image you got was the same. And so we added these nuances. And so, hey, Kate, that's incorrect. We'll answer your question, but yeah, we see it. Sorry about that. COVID-19. So now when you search, if you get something that's for both regular SHIP, like medical supplies, it won't be the same icon. So let me show you an example of that. This is what it looked like before, right? And so you can see that all the icons are the same, no matter whether it's coding staff. And so now this is what it's going to look like when you look up those same things. And so you can see the difference very clearly, the 19, so it's identifiable real easy. Now these COVID-19 categories and items probably won't stay in there for after the new year, most likely. So we don't have to worry about it too much longer, but we did think it was important enough right now to make sure that when you're using the search tool function that there wasn't any overlap. And then the last icon change was this little bad boy right here, which is a definition dictionary thing. And one of the deals is we added a new definition category. So and this is going to take probably another 5 or 6 days for the website to refresh and update and become fully functional. So don't expect this to happen right now, but it will be happening in the next few days. The new definition category contains definitions of commonly used terms like supplies, equipment, medical training. Those are just examples. But we realized that we were using terms like, oh yeah, training's allowed. but not all training, right? And so what did we mean when we said the word training? Or what did we mean when we said supplies or furniture, right? Because everyone describes this differently. And also the federal government describes it differently. So that's very important to note here too. These definitions are kind of how we in our circles kind of look at your questions and your responses. Like, okay, they want to buy these supplies. You know, are these supplies for patient treatment? Are these supplies for training? For patient safety, where are they at? So we wanted to nuance that. The federal government definitions are generally based on price and less on item. But for our purposes, we are very item based and less price based. So we had to kind of nuance these definitions and define them based on the items that you would be purchasing within these categories. So hardware, supplies, equipment, infrastructure, things like that. But that does not override the Federal Code of Regulations or their definition when it comes to reporting or anything like that. So we're not attempting to do that. We're just attempting to add clarity to how we determine whether or not it's an allowable or unallowable. And hopefully these will populate. So if you just looked up training, the definition for training will be right there on the top. So you can kind of say, okay, let's look at that a little bit more. Or let me see what, you know, Krista or Matt or Sally are thinking when we say the word, you know, patient supplies. What does that include? So we wanted to help you out with that. And the intent was to help the user and staff be consistent, that you and I were on the same page with the words, and that you and your PO were on the same page to help identify expense purpose. We often say this, and you've heard us say this, like what, you know, the intent of SHIP, the intent of, you know, the grant, and we wanted to help nuance that and say, hey, here's what the grant is intending to mean when it says XYZ. And then this question, but what do you mean by? And so we are more than happy to answer all your emails and we love hearing from you, but that's all a common question. But what do you mean by patient supplies? What do you mean I can't buy a CPR dummy? You know, things like that. So we wanted to help with that. So this is what that will look like. Here's two examples of that. What we consider a certification. Certifications are unallowable, but training is allowable, right? So we kind of wanted to help nuance that. Furniture is also unallowable. So again, it's furniture, that's not the same definition as the federal government's, but that's how we see it. And so that's what it will look like and when it populates in your search results there. So that's kind of the end of that right there. We do have a center website update coming up. And then of course the functionality of the search tool will continue to be increased and nuanced more moving into the future as we upgrade our website. Also, one thing that I have requested and that they're looking into is insight questions. So while you're in the search tool, should you come up with this and you have a question about certification, you could click on that and send us an email directly about that rather than opening your email and writing and typing it out. You could just click on that and it would automatically say, okay, what question do you have? And we'll get an email about that. We're trying to make it super easy on you to answer and get or ask and get responses. And so you will notice also on the search tool, which I don't have an example of, but you can look at it right now. There used to be about 7,000 lines of keywords, and those have been dwindled down to about 6 lines. And that was on purpose. We try to bulk them into the keywords to very large categories and focus more on the metadata. So, you know, pen, pens, pencils, penciling, pinning, you know, touch point pins. Those are not all going to be keywords that you can click and then they'll all drag down, but that would be something you search. The keywords are broader, like, you know, I just have questions about EMS, just general. You can click that and it'll show up everything that pertains to EMS. So that's that. And we do want to kind of open it up. I'm assuming somebody answered Kate's question. And kind of open it up at this point. We have a few more things to share with you at this point and see what questions or comments or concerns that you have about anything that we've mentioned. about the assessment results, about Krista's comments about the deadlines and reporting, or about the search tool. Does anybody have any questions or anything to add? And feel free to give feedback right now on, hey, can you add this? Can you do anything like that? You can come off mute or put it in the chat.
Matt, Dorothy from New York had a question, and Krista might be the better person to answer this. Our subcontracting unit distinguishes supplies versus equipment by price. Should we go by HRSA's definition instead?
Yeah, so that's a really good question because we know that each of the 46 states operates differently. So generally at the federal level, we consider equipment to be anything over $5,000 and supplies to be less than that. So that's why the definition for the purposes of SHIP is a little bit different. So I would say don't get too bogged down in the nuance for that, because technically like supplies is an unallowable line, if I am remembering correctly. So if you have questions about a specific supply / item and how to put that in your budget for either HRSA or for your state to indicate the cost, reach out to your PO and we can talk about what line that's best put under when you're doing your budget. But since you are essentially the pass-throughs for each of the hospitals, you're really not reporting to us that level of detail. It's what you need to do at the state level, for the hospitals that are wanting to buy supplies versus equipment, and really going by what you at the state level use for that demarcation. So I don't know that was a straight answer, but I think it's the best answer I can give you, since again, I know all of you are in different situations. So I would say reach out to your PO and we can have a more nuanced conversation.
Yeah, and we, in the new update to the social, we nuanced supplies a little bit in that we broke them down into categories. So if you search supply or supplies, right now, I'm sorry, I'm looking at this third screen way over here where it's the first thing that pops up is like remote and telepharmacy services. That would be something you would buy supplies for. So it's listed in there, like here's some of the things you can buy. But like messaging, marketing, and community outreach would also be something that you would buy supplies for, and that's not allowable. So we did want to break that down for you. And so again, we have the COVID stuff. Training supplies is in there, that's allowable, but office supplies are not unallowable. We didn't want you to have to look at pencil again and this, so that we bulked them up for you. So, office supplies generally are unallowable, and here's a list of things that would fit into that. Medical equipment and supplies, including EMS, those are unallowable. Here's a list of things that would be unallowable under that category. However, telehealth application and implementation, you may need some supplies for that, right? And that is allowable. And here's a list of those allowable expenses under that category, again, to help you search. And so, but yeah, we can help you nuance that even further. So please, 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 you are never, ever, ever bothering us. Even if you send us 500 emails in a day, that's what we're here for. That's what we want to help. That would be a lot. And I would be concerned for your health, but and your sleep schedule. But yeah, no, we would be more than happy to help you with anything that needs to be helped. And so, yes, what other questions do you have? Yes, about the contractors conducting the survey. Yes, for HCAP surveys, yes. Apologize. Hospital consumer assessment, healthcare providers and system surveys completed for inpatient services are an allowable use of SHIP funds. Yeah, there's a typo in there. That last word on that, and somebody caught that, which I can fix in 2 seconds, is it should say that the costs associated with conducting surveys and assessments are allowable if it's the HCAP survey. So sorry for that confusion, Kate, but that's exactly the feedback that we need to hear. Any other questions, comments, concerns? Can we nuance that any further for you?
This is Stephanie from Idaho. Sorry to confuse the two grants, but is I know with the icons that you did for COVID-19, is this tool also meant to be used for the ARPA funding to be able to look and see what is or isn't available or allowable, sorry, with the SHIP ARPA, or is this only for regular SHIP?
No, you can use it for both. If ARP is going to be a little more complicated because it allows things that regular SHIP does not allow. And Krista, feel free to chime in on that, but you can use for both. That's why we had the different icons. And that's what was confusing before, because there was really no visual distinction between the two. But yes, you can use it for ARP searches. They're going to be broader categories. And I don't think Jason's here today, but he would be more than happy to answer specific. If you're like, hey, we're really looking at this, we're really looking at this for ARP, he can answer that if the search tool does not answer that for you. So.
Okay, because I think my feedback would be more that because we're only allowed to ask him and we have to wait for him to be able to respond to us about allowables for that particular grant, are those, I know with you guys doing both, where you're kind of providing the technical assistance and you're sort of updating the tool as we ask, and you're being able to modify it real time, which I sincerely appreciate as somebody who does email you quite frequently. And I always check the tool first now, because you are working on it so hard, and I absolutely appreciate it. I was wondering if on the ARPA side, if it's the same approach, where if we're asking consistently similar questions and maybe that tool does not show that, is that then fed to you and then you're updating the tool as well, so that we're able to kind of capture real time some of the nuancy pieces of this other funding?
Yes, and I apologize. Jason is here. I can't see the attendees list. Jason is here, so he can chime in if he wants to. But yes, we have constant, Jason's in all of our PO meetings. We have constant contact with him. He lets us know if there's something that needs to be changed or updated on it. Keeps us informed about weird things that pop up that maybe that weren't answered before. So yes, it's kind of the same structure. Again, great. ARP, ARPA stuff is gonna not be forever, fingers crossed.
Right. Yes, feel the same way.
But yes, we are in constant contact. And Jason, if you want to add anything to that, you're more than welcome to.
So the only thing I'll add is, Stephanie, you bring up a generally great question. I feel like part of the issue with the allowables for the ARP awards is there are a lot of things that are allowable under ARP, as long as it's justified in a way that makes it allowable. And so it's hard to capture that level of nuance in a tool like this sometimes. Yes. So we're doing our best to feed that to Matt, but what might be allowable in one situation may not, if it's not justified in a similar way for another hospital. So it gets, and that sounds really strange and complicated, but it's just the way that it is for this award. Hospitals have to have it as part of a larger COVID-19 testing and or mitigation kind of plan to make it allowable. And so, yeah, it all just kind of depends on how they frame it.
Yeah, and I would say it's more, for lack of a better phrase, more fluid on the ARP side of things. In other words, we want to hear, I think Jason was saying, he wants to hear why you're going to use this money for this purpose, right? Like, tell me what it is so they can nuance it, which is why you go to him directly. For us, we want to hear that too. Like, hey, we think it's going to be ACOG or whatever it is, but we're a little more finite in what it is. So it's hard for us to nuance it quite as extensively as what we've done with some of the items in the regular SHIP area. But we do like you said, we are doing our best. And so, yeah.
I just want to say, Stephanie, like some of this might also be my fault because as I was learning SHIP and using the tool for my own, I was getting very confused because there was just that tiny little, COVID ARP in there. I was like, wait a minute, if my eyes can't discern this, how are other folks? So I asked for the distinguishing visual for a little bit more clarity, around some of the categories and things. So a lot of this too, if I was struggling as someone who was brand new to this, how was maybe another brand new SHIP coordinator? So for those of you that were more seasoned and are maybe finding this to be, a little bit extra, as we say, then, that's my fault. And so I want to own up to that and say this really was something that I saw that I was struggling with and thought I couldn't possibly be the only one.
Oh my gosh, no, totally appreciated. Just as a seasoned SHIP person, I absolutely agree. And my eyes could not discern as well. So I actually very much appreciate it. And I just wanted to make sure I could still use the same tool for both. So thank you for making it user-friendly in that way. I really appreciate it.
Yeah, and for the seasoned SHIP coordinators that are on the call, thank you so much for your feedback on your different takes. And for the new coordinators who are like, I can't use this. I have no idea what this is. That was really helpful too. And I would never put a negative connotation on the feedback and that perspective that Krista brought to the conversation. It was extremely helpful because we look at it all day. We've been looking at it for several years, and we just keep filling it up. And then it was very helpful to have a different set of eyes on it. And we appreciate all your feedback, because sometimes maybe you don't need it. Maybe most of your hospitals are doing HCAP surveys, but occasionally you do. And if it gets in there and it's cumbersome and it's not functional, we want to know that. And so very much appreciated.
And since it's right at the June 2nd, and for those of you who do that, which are most states doing the individual awards, that you share the search tool website. And if they are seeking, especially on the American Rescue Plan with 6 months left to go, of examples of what is allowable, that's something you can do too, is just search everything allowable in that investment category, being in the American Rescue Plan. It pulled up, I just tried it, 25 different allowable activities in there. But you can do the same thing for ACO and just see like what is allowable in that area. And as Matt said, we've tried to refine it to, if it's things not allowable, then underneath, is there something related that could be? So I encourage you to share this with hospitals as well.
Yeah, we definitely try to make it container friendly. So containers with labels and directionals and everything else. And it will be a little bit harder. I know sometimes, I was just thinking about this, sometimes when you guys email us, you will copy and paste what's in the search tool. Some of these are a lot longer than what they used to be. So you may want to just, be cognizant of that. They're not like pages and pages long, but we do include a lot of examples in them. So take the time to read them and become familiar with them. I do more than want to take more questions, but also want to tell you about something that we have coming up. We are planning, and we're working in the final stages of finalizing the details on doing a learning collaborative in August about advancing health equity in small rural hospitals. And this is in alignment with the value-based care and QI area of SHIP. And it will be available for SHIP coordinators. And so this is, as you guys know, maybe from task, or you don't know because you're only in SHIP, learning collaborative is a little more intensive, couple hours over the course of several days over the course of a few weeks, where we take a topic and we really dive into the topic and really extrapolate its content, its purpose, and its applications to the grant. They're usually a lot more fun, a lot more collaborative, smaller group. And so we will be looking for an email from us about registering for that, or letting us know if you're interested in that. So keep that on your radar. That'll be in August. We do understand that that's a hot month, maybe vacations, things of that nature. So, but we did put it there because it was between July and school and then Labor Day, and we wanted to make it as accessible as possible for everyone, but also not, right at the beginning of the fiscal year when NCCs were due, reporting's due, but hopefully that's not as hard. So any other questions, comments, concerns? I'm going to launch the end polling now. So if anyone needs to cut out, they can. Please finish that polling up for us. And then we wanted to take the last few minutes, have open office hours. If you needed to discuss something directly or have a specific question, we wanted to make sure that we are here for you and make sure that we're here to help you. So feel free to stick around for a few minutes. And if not, we hope you have a great day. Please play with the search tool and tell me what I did wrong on building it, or tell us where we got the definitions wrong, or if something's confusing. Like I said, we just found a mistake right now live in front of you. You can watch this back and see it happening in real time. And so We're not perfect, and we appreciate your responses and your feedback on that. But we hope you guys have a fantastic rest of your Thursday and a great weekend, and let us know how we can help and if these tools are helpful to you. And yeah, we look forward to seeing you. If you have any questions, feel free to stick around and hang out with us for a few minutes.
So nobody's talking. Can I hijack and ask a question of Jason while he's still on?
You can.
Sure.
Okay. So on that, well, and actually it kind of involves you too, Matt. So when you showed just that screenshot of the allowables for staffing when it came to the COVID, the AR, I think you're calling it ARP grant, it just said testing, I think is what I saw when you showed it just now. But on the allowable expense tools, it also talks about paying for screeners and couriers.
That's just an example.
Oh, okay. But does the tool actually show more of the options? Oh, okay, good. That's what I want to make sure of, because I'm like, oh my God, I just approved somebody that was going to do that.
No, you're fine. I use that example to show the red, green, and yellow.
Okay, so there are, when I actually go into the tool, which I have not done, because I've actually been using the static copy of the red, green, and yellow. I don't know why that speaks to me, but I use that all the time. Sure. It's like my go-to every day. But I really want to try and start using the allowable tool, because I think sometimes you'll end up clicking on something and then it leads you down a rabbit hole that kind of shows other stuff that you weren't thinking of. So I just wanted to make sure I was understanding that correctly.
Yeah, so if you type in payroll on that search tool, it'll pop up with COVID-19 salary and benefits, testing staff, travel nurse, employee burnout, mental health. It has other nuances with it. So yeah, I just was looking for a good red, orange, red, yellow, green example.
Perfect.
Yeah,
okay.
And I did, I selected investment category of SHIP ARP and then just hit the word salary, Stephanie.
Okay.
And got, the two allowable being courier and screening, and then not allowable was staff, regular hospital staff, and then the travel nurse being.
Yeah, and in a few days, probably early mid next week, Stephanie, this will, when the system updates and they do all the coding changes, that investment status will include like COVID allowable, COVID unallowable, COVID PO. So you don't have to do all of that. And so it'll be a little more intuitive in that way.
Perfect. Perfect. That helps a lot. Thank you very much. I do appreciate the amount of work you guys are putting into this, and it's so appreciated.
And that makes it all worth it. Like it really does. We really think about you guys and really take that into consideration. I keep a running list. People say, can you add this to the search tool? Yes, we can. Like I certainly can. Would be more than happy to. So we appreciate the feedback.
Perfect. All right. Well, thank you.
Thanks, Stephanie.
Krista, Jason, I don't think, actually, Krista, I think in the time that you were out, that whole time, my partner accepted a new job in Oklahoma City. We've sold our house and are moving to Oklahoma City tomorrow.
What? I didn't know that. Yeah. Oh my gosh. Congratulations. That's amazing.
All that happened in like 15 days, 16 days. So.
Oh,
Yeah, that's why there's like nothing, but this is yesterday there was stuff here. There's nothing in the house anymore. So
I just thought you were in a different room, but yeah, I see like all of your cool decor is done. Wow, that's fast.
everything is in the box.
Wow.
Congrats, Matt. Or congrats to your partner. Good luck with all of the move.
Yeah, no, at first I was like, Oklahoma City, okay. But I've been there and I love it, and I've been researching cool things, and it's going to be an awesome opportunity. So I'm very excited about it.
And Caroline, I saw your chat. I'm just trying to find.
Thank you.
So what's the new job? What's he gonna be doing?
I'm gonna go ahead and stop the recording, sorry.